Is Jumping Frenchmen of Maine. The Jumping Frenchmen of Maine is a neuropsychiatric disorder that causes an overreaction to a stimulus. The individual suffers from an overactive startle effect in response to a sound, sight, touch, or having a command yelled at them. The cause of Jumping Frenchmen of Maine is unknown. It was first discovered around 1880 in Maine. French Canadians traveled to the Moosehead Lake area in Maine and worked as lumberjacks. The Jumping Frenchmen of Maine has also been grouped into other disorders known as startle matching syndromes. It's believed that genetics, culture, and isolation all play a role in this disease. The symptoms include an exaggerated startle reaction to a stimulus. One may overreact to a sound by jumping, screaming, hitting, throwing, and in some cases, following absurd commands involuntarily, such as punch him or hit her. Typically, these reactions will lead to harming themselves or others around them. The startle effect tends to become worse with repetitive stimulation. Typically, everyone has a startle response. In this case, it is extreme. The diagnosis is typically geared towards ruling out other disorders through clinical tests and also with a history and physical exam. There's no specific treatment for the condition. There are ways to reduce the stress, such as therapy and geared towards education and medication for anxiety. Avoiding situations that cause one to be startled may also be effective. There's no known prevention because the cause is still undetermined. The thought that the disease may be genetic could sway some to believe that there is no possible prevention for this disease. It is known that the condition affects men more than women, and onset is typically around childhood and puberty. Living with the disease. Dr. G.M. Beard studied the jumpers, that's what he called people with this disease, and received some feedback in detail about how this disease affected their daily lives. One of the men described it as exhausting. In some of the articles, it also points out how other men would harass the individuals for their own entertainment. This is out of one of the articles from Dr. Beard. One of the jumpers, while sitting in his chair with a knife in his hand, was told to throw it. And he threw it quickly so that it struck in a beam opposite. At the same time, he repeated the order to throw it. So basically, he was told to throw the knife and he threw it, but at the same time he also said, throw the knife. If I or a family member had this condition, I would want to do a trial of medications to see which one or if any could help. I would also want to learn some measures for helping control my reactions to stimulus or tactics that help me remain oblivious to them. I think the most important aspect would be having family and support around you and making sure that people were going to protect you from others that were enjoying teasing you because of this disorder. I think it would probably be really embarrassing if you had this disorder, as well as mentally and physically exhausting, considering that you can't control your reactions or behavior, and you probably feel pretty isolated being stuck trying to avoid this all the time.